my one-on-one coaching is finally open. The waiting list was there. It was full. I am now accepting one-on-one coaching patients. If you are interested in doing one-on-one coaching with me, I'm going to keep it 100. This is going to be work. This is for someone that is sick and tired of being sick and tired and ready to step their game up, honey. For real, for real. When I say that, I am talking about going from endo warrior to endo conqueror. Let's talk about an endo warrior, because I've called myself an endo warrior, and Lord knows I have been there before. An endo warrior is someone that gets up every morning and we are literally at war with our body. We're fighting our body. There's the brain fog. There's the chronic fatigue. We set the alarm for 6 o'clock. We hit the snooze. We get up at 7. Then we're back in the bed at 8:30. We're dreading the day. We don't have energy. We're bloated. We're fatigued. Gas. You know, all the ish that we deal with. On top of, or should I say underneath, a chronic pain pulsating throughout every fiber of our body. May that be joint pain. May that be a migraine. May that be hormonal acne. That is an endo warrior. Nothing against an endo warrior, but here's the deal. One day I woke up and I was like, okay, being at war is one thing. Endo warrior, okay, I'm feeling it, but here's the deal. Honey, I'm tired of waking up every freaking morning being at war with my body, being at war with my digestive tract. What can I eat? What can I do? Being at war with my budget because I've got to spend all this money on alternative therapies and, supplements and different things like that and doctor's appointments. Being at war in my mind where my mental health is diminished because I'm being gaslit by partners and family members and doctors and everyone around me. That is an endo warrior. And so finally one day I was like, you know what? I'm tired of being at war with my body. And so if that is you, you're sick and tired of being sick and tired, let's talk about what an endo conqueror is, honey, because that's where we really want to be. We are not saying that endometriosis is not real. What I am saying is when we step into the power of an endo conqueror, it looks a little bit different. We are not driven by the symptoms. We are no longer hiding in plain sight, not able to manage our health. We are no longer driven by the woes of the symptoms. We are no longer driven by an unreliable body. That is what I'm talking about when I say stepping from endo warrior to endo conqueror. Now, let's be honest. Stepping from endo warrior to endo conqueror, honey, it's easier said than done. It takes a lot of work, which is why I have created my one-on-one endometriosis coach program. This 3-month coaching package is going to put you in the driver's seat of your health. We're going to touch on nutrition, mindset, lifestyle changes, performance regulation. Let's also be honest, when you are dealing with endometriosis, your performance is not where it needs to be. You're not able to get that promotion at your job. You're not able to even show up to your job on a regular basis. Your mindset is just diminished. You are dealing with a lot of different things. And so in my program, we don't just talk about eat this, don't eat that, do this, and take a couple Epsom salt baths. We take it a lot deeper to create an exact program for you and your situation. So if you are ready to transition from endo warrior to endo conqueror, I want you to either go to the link in the podcast, click that link that says work with me, and book that free discovery call, and let's get you in the driver's seat. Maybe you're like, okay, I need a little more information. Feel free to click the link and the podcast notes, go over to my Instagram and just binge on all that free content. Then you're going to scroll back to the top, click that link, and book the call, work with me. I'm super excited because Dr. Helen is coming to us, right? And I wasn't sure how to title this one. I'm still trying to figure out what the title is going to be. So today we're talking about when the pelvic pain strikes. What do you do? Now, you guys know I'm all about having your toolbox ready, having the tools in there. Some of y'all toolboxes is a little light. You only got a couple of tools in there. May it be some ibuprofen, some of your narcotics, maybe your heating pad. When you're dealing with pelvic pain, the heating pad and the ibuprofen, baby, those aren't going to be good enough, right? So I love to bring different professionals, as I would say, and experts on to give you more tools for your toolbox. Like I said, the worst time to be on Dr. Google and YouTube University and texting your homegirl and scrolling through my Instagram is when you're in a flare. I'm not saying it's too late, but what better way? Why don't we start being a little more proactive? So today we're loading up the toolbox. So I need you to get the toolbox out, throw it on your desk, open it up. So I'm going to have Dr. Helen do an intro, tell us a little bit of her backstory, why she does what she does, and then we're going into all things pelvic pain and what you can literally do once the pain strikes.
Hey, LJ, I'm so happy to be here. And, I'm such a big fan of how you empower your community. And I love what you said about the toolbox, right? Like you are just giving them so many tools, whether that's internal, external, what are we putting in our body? What kind of products are we using? Like just really gearing up, because that's all we can do is try to balance out and feel like we can have a little bit more control over what seems so uncontrollable. And you're absolutely right. I mean, the more that you have in the toolbox, the less that you're in this suffering state when the pain does hit. So I'm Dr. Helen Pora. I'm a physical therapist. I've been practicing for over a decade now, primarily with high pain patients. I work a lot on injury prevention just because I've seen the other side of it with complicated spine cases, nerve pain cases, CRPS, which is a nerve disorder where we are trying to reorganize a painful nervous system. So although not all endo-specific, in the world where the nerves are not giving the input to the brain properly and trying to reorganize and centralize that pain. So that's a little bit about what I do on a day-to-day basis.
If you have the diagnosis of endometriosis, everything's endo-specific, because once again, I say it like a broken record. Endometriosis touches every fiber of your body, right? It's chronic systemic inflammation throughout your entire body. For one person, that may be debilitating neck pain. For another person, maybe it's hormonal acne. For me, it was nerve pain, joint pain, all the pain. So I know some of you are like, I don't know if this is going to pertain to me. Stick with me, girl. Yes, it is, right? If you got a uterus, you're going to want this information. So let's talk about with endometriosis, like I said, chronic systemic inflammation. In your practice, Dr. Helen, what do you see with maybe not just anyone with endometriosis, because maybe you've got PCOS, maybe you've got fibroids, maybe you're just kind of like I say, right? You're like, something's going on down there. I don't know what the heck is going on. Let's kind of tie this together of what you're seeing in your practice and start really building that foundation of those tools that you bring to the table.
So what I see is that anybody that's been in pain in their abdominal region or pelvic floor is going to have altered breathing patterns. And one of the first things that I try to do is I just take baseline assessment of, is my patient able to get a diaphragmatic breath? And they're like, yeah, so what? I breathe all the time. Aren't I doing that right? Like, I could care less. Just tell me what's going on down there, right? But what ends up happening is that if you've had pain anywhere in your abdomen, as you know, what are you going to do? You're going to try to brace yourself. You're going to try to get away from the tummy, and you're going to start breathing out of your chest and neck. Mm-hmm. And what that's going to do is send us right into a sympathetic stress response. So when you're in pain, you're on high alert. And that sympathetic stress response sends chemicals out to your muscles to tighten them. It's called tonicity, right? So this is something that you deal with when you're running away from a bear and that sort of thing. But when you're in pain, you're dealing with it all the time. So what I try to tell my patients is I first explain to them the anatomy. The diaphragm sits on the lower part of your ribs. And you can imagine that this is the hat of the core. After that, you have your transverse abdominis, which is the inner layer of your core that sits on top of your intestines and your organs. And then the feet are the pelvic floor, and that wraps all the way around like a girdle. So what ends up happening, you have this system that is supposed to be working together that ends up getting altered. So whether that's after one pain episode, it gets altered, whether you have some scarring down there or a C-section, or, you had a history of appendicitis, anything that has affected that system, it might have changed your breathing pattern. Maybe even just having trauma in your life, a bad relationship, stress in school. There's so many different factors, but whatever that was, it could have changed it. And then you end up adapting these postures. So here I am taking a baseline of my patients. Here's your diaphragm. Here's how it's related to your pelvic floor. And then what I try to do is I try to tap into being effective in using your diaphragm. And here's why. We talked about this fight or flight sympathetic response that most pain patients, most people that have high inflammation, high pain are in all the time. What we need to do is put the dimmer switch on and have it not be on such high alert. And how you do that is tapping into your breath, breathing in through your nose, finding where that diaphragm breathing is, and actually breathing down into your belly, having that breath go all the way down and having it relax your pelvic floor. Now, of course, this is ideal when you're not in high pain to know where these parts of your body are. But even when you're in pain, it can serve as an extremely useful tool. And we talked about all all of those nasty chemicals that try to help us when we're in that sympathetic response.
Right.
Now we're tapping into parasympathetic. This is basically the pharmacy of the body. You are tapping into relaxing, right? So that tonicity in the muscles starts getting relaxed. The pelvic floor spasm starts relaxing. So if you can tap in, if you have the ability to say, okay, I'm in high pain. I know it hurts those first couple breaths. I can guarantee you that you'll knock that pain scale down by quite a bit just by tapping into the breath and making use of this built-in pharmacy that we have.
I love it. Your girl, she laid down the foundation. So I want to circle back. So many things, but the biggest thing, dampening down the pain. As a chronic pain warrior, I'll just put it that way. I know there's no cure. The pain may come. There are definitely things I can do with my nutrition, fitness, and lifestyle, but adding this tool to the toolbox to damper down the pain. Let's talk about when I was in an endo flare, it was 24/7 pain. Maybe it was a little cramping and bleeding around my cycle. Then it turned into pelvic pain 24/7. Chainsaws dancing up and down in my bladder, being ridiculous, doing a bunch of plyometrics and all of these crazy bouncing and jumping rope, right? Like it was just everything I didn't need, but I didn't have this in my toolbox. So for many of you, I'm sure she got your attention when she said damper down the pain. You're like, yeah, sign me up. So now that I've got your attention, you've got that foundation. Let's talk about what it looks like when you're not doing that diaphragmatic breathing and maybe break it down. Because I know some of you guys are like diaphragmatic, tenacity, we throwing out all the terms, right? Today, you're going to get an MD in these terms. We are bringing it. Don't worry. You don't have to go to Dr. Google. We're going to break it down right here. So let's give them that foundation of what is diaphragmatic breathing and what does it look like when you're not doing that diaphragmatic breathing?
Yes, absolutely. I know that can get a little crazy when we talk about that and everyone just blacks out, but it really isn't. So what it looks like when we're not. So number one way I know that you're not using your diaphragm is if you're a mouth breather. So if you are primarily mouth breathing, you're telling me that you wake up with a dry mouth, and that's just something that I witness you even complain that you have, obstructed sinuses, whatever that is. So if you're mouth breathing, it is very difficult to contract your diaphragm. Okay. Another way that I can look at that, and people will tell me all the time, I carry the stress in my shoulders. I breathe through my shoulders. So I would say so many of us are dominant upper chest breathers. And this is so strategic. Our bodies are so smart. It's going to find a way to breathe. Of course you're breathing. We're breathing 20,000 times a day. So you don't stop breathing. What you do is you still need to lift your ribs up. And the way that we do that, we're so smart, we use our chest. So instead of expanding the lower ribs, what we do is strategically use the chest and neck muscles, and we lift the ribs up in order to allow that oxygen intake all the way down. But what ends up happening is that you just end up turning off your diaphragm completely, not tapping into all of those great benefits. And so, so what it looks like is just, that person that tells me I get a neck massage, but then my neck tightens up right away again. Or, it only lasts for a little bit. And that's probably because they're using their neck muscles to assist with their breathing.
So now we know what it likes when you're not doing that diaphragmatic breathing. Walk us through some of the steps. If someone's like, okay, I'm buying this, what do they do to start turning on that diaphragmatic breathing? Like now that they've got that tool in their toolbox, what are those little ABCs and the 1, 2, 3s to add? And then what are some of the benefits that one may see? And once again, right, benefits may come with a couple days. Some of you guys need to do it a couple months. Some of you may need to, tap into some of her services, pelvic PT, whatever it should be. But know that consistency is going to be huge with this.
Yes. I love breaking it down so much because first of all, it's free, right? And you access it all the time. And you can access it when you're not in pain, if you just, want to have that be a part of your practice, or you access it as the toolbox when you really need to grab something extra and tap into all of those benefits.
Exactly.
So here is how I would have somebody start. First, I would have them find where their diaphragm is. And the way that you do that is you have your hands on your lower ribs. So imagine just kind of wrapping your hands around the lower ribs. So that's kind of the area that the muscle sits in. You don't have to keep your hands there if it stresses your neck out, but at least you know what we're talking about. Maybe rub your tummy a little bit, just kind of give it some love. Number 2, place your tongue on the roof of your mouth and then gently close your teeth so they're just approximated but not clenching, and then close your mouth. And from there, so you're not clenching, it's just kind of slowly there. It's kind of a weird thing, right? We have all these things to think about, and now I'm having people think about their tongue too. The last thing you would think. So the more that you press your tongue up to the roof of your mouth, the more you have the ability to get get the right position for the diaphragm. Once you have the mouth position, your mouth is closed, the tongue is up, you use your breath through your nose. So if this is hard, you could even flare your nose out a little bit the first time. And then you inhale. As you inhale, you're going to bring that breath all the way down. Maybe give yourself some feedback with having the hands on the lower ribs and try to just give yourself a fat belly. Now, this is not perfect. This is not completely anatomically correct, but I think that that cue works really well because I have you sit here and give you a headache for finding your diaphragm. We're so used to holding our tummies tight, whether that's for pain or whether that's because we like the way that it looks. Let the belly go fat. On the inhale, everything relaxes. Your intestines relax, the tummy relaxes, the diaphragm presses down, and the pelvic floor opens like a flower. And so that inhale is really, really powerful, right? And this happens in about 4 seconds. The stronger your diaphragm contraction gets, maybe you can make that go to 5 seconds. You might notice you do this great positioning on your mouth, you breathe in through your nose, and you feel like maybe you only have 1 second breath. Right? So don't get frustrated with that. On the exhale, your mouth stays closed and then you slowly exhale through your nose. Your tummy doesn't have to do anything at all. So really, we're so used to holding tight that what I end up using the intervention on first is having people concentrate on the inhale because the inhale is the relaxing of the muscles, relaxing of the pelvic floor. So that would be the start position. Now, most people have been dominant, and including myself, with the neck breathing, that sometimes it's even hard to get the diaphragm to do anything.
Right.
And what I recommend, if it's possible, is child's pose. Child's pose, your forehead is relaxed, so your neck muscles are relaxed, and it's just a very relaxing position. And it's a really easy position to have that belly go really, really fat and heavy and just kind of find where the diaphragm is. So I find that being a really useful tool for my beginners until they start to tap into this.
And it's also body awareness is what I'm hearing, because some of you are like, diaphragm, what, lungs? Like, especially when you're in pain, it's like everything hurts. And I've asked patients, they've called me in a flare and I'm like, what hurts? And they're like, I don't know, everything is hurting. Take some body awareness. But when you're in pain 24/7, everything is clenched up. Everything is effing uncomfortable. Everything is tight. When you think pelvic floor, you're like tightening. And it's like, what can we do to open everything up? I think that's one of the things that we have to wrap our heads around. You know, we want to put the heating pad on there, but then it's like, we only want to do the heat, but we don't want to do the stretching. And it's like everything nice and tight. You know, some of you, maybe you have incontinence, you have bladder issues. So you're like, I want to tighten everything up. But it's like the tightening everything up, I think, has its time and place. And so as we bring in some of that body awareness is what I'm hearing, then we know when to release. Yes, we love the aesthetic of the six pack and the flat abs, but if that aesthetic is having you tighten everything up all day and you're sitting at your desk in pain, you're cramping and everything else, maybe it's time to try something new. Talking about dampening down the pain. We're talking about maybe some diaphragmatic breathing, taking the pain from a 10 to a 6, a 10 to a 4. I don't know about you, but when I was on a 10, I would have been happy for a 9.5. I would have been happy for anything. So it's once again adding this tool in. So once people start to really tap into the diaphragmatic breathing, what other benefits are we going to start seeing with that pain? Because I'm sure if everything isn't tightened up 24/7, there are going to be other benefits that we may not be aware of.
100%. And I will tell you this, that the moment that you can take your pain down, like you said, just dial it down a half notch, 1 notch. Wow, something worked with my breath. It is so powerful. And I'll share you a really powerful story in a moment. But yes, so getting that awareness. And then what it does is that it transfers straight over into function. If you're used to bracing all the time, then when you go on a walk, when you go to try to do something extra, you're not going to have a lot of wiggle room. Everything is going to be high impact for you. But when you can really tap into learning how to relax your pelvic floor, you're just going to allow yourself to do so much more before getting into pain. Because when we're in this bracing mode, and, I just imagine our poor friends and, we've experienced it ourselves where you're in that fetal position, you have the heating pad, right. You're just like, don't move. And maybe I can get a little bit of relief for like 30 seconds until I pass out or whatever it is that's going to help me. When you can actually dial into our body's own mechanism of relaxing, it can be hugely powerful.
Love the passion.
I think that where it goes from there is that, it really will transfer over into function. And again, just having anything that's going to give you a little bit of power over the endo endo versus it controlling you is such a huge shift. And let's just talk a little bit about pain and why our body produces pain. So our brain is so powerful. And I think that I even heard you saying something, I don't know, did you say chainsaws down there?
Yes, yes.
So in my experience, like with my patients, we start even naming this, right? Because now it's not even a part of our body. My arm feels like it's this, or, it feels like there's somebody stabbing me in my uterus. And so
Right.
now, and not that we can't joke around and we can't do those things. This is where I get really hippy dippy and I start really talking nicely to our body because of what our brain does. So our brain's job, it doesn't know what it's doing. Its job is to protect ourselves. So if it's in pain, it's getting that feedback, right? And especially with high, we talked about, the nerves are on high alert. We have that dimmer switch. It's not on dim, it's on high alert. So our brain is trying to process information and wondering if it should pay attention to it or not. So it's really difficult when you've been in pain a very long time. That image in the brain gets a little bit blurry. This is just what we've found. And what can help you get out of pain is by centralizing your pain through understanding the nerves, why they're doing that, and just tapping into this nervous system, getting out of that fight or flight response. So if our brain's primary job is to protect us, if we know and we're thinking, oh, if I go do that, it's going to cause that chainsaw again, it's not going to let us do that. I guarantee you. If you're around that person that makes you feel unsafe, I guarantee you your brain's going to protect you and not let you do that. So there's just so many factors that come into this, girl, that, I don't even know where to start, but
no, I love it.
Give you a picture.
No, I love it. And she said, let's get hippy dippy, baby. Let's get hippy dippy. Let's even get a little woo woo for a second. There's power in our words. And I say it all the time. If you realize I don't say my endometriosis, my IBS, my asthma, baby, that's not mine. That is my diagnosis. Yes, it is something I have to manage. But that old mindset where I used to walk around like, I hate my body, I hate my uterus. And it was because I didn't know what was wrong with me. I hate everything about my body. I hated my doctors. Like that is what came out of my mouth 24/7. I'm always in pain. There would be times, and I kid you not, I would just be taking pain pills, going through the motions, hadn't even really stopped to assess, was there any true pain? Now, yes, I understand. And no, I'm not saying to stop your medications, but sometimes we just start going on clockwork, right? And it's like your body is all tensed up. And it's like, okay, let's have some body awareness, right? But I understand when you're in pain, you just want the pain to stop. But like I said, let's start being a little more proactive rather than reactive. Yes, your period's going to come once a month. Yes, you may have low energy. There are different things that you can do. And these are all things we're going to cover on the podcast. But like I said, these first episodes, I want to really start laying the foundation because I think sometimes we just get stuck with, like the episode about nutrition where, the endo diet doesn't work. Well, there is no endo diet. What works for me may not work for you, but could be awesome for Dr. Helen. So we have to kind of find what works with our body. The same thing with body awareness and pain. What works for pain management for me could be nothing for you. Maybe for me, I know for me, magnesium, especially because I'm blood type B, baby, put me in that magnesium bath and it just calms everything down and I sleep amazing. Maybe for you, you need something else. I remember when I was going to pelvic PT, at the beginning, I was going twice a week. Then I got to where I only needed it once every few months to check in, but it depends. But I think what we have to do is like take those blinders off, take those misconceptions off of, oh, there's no cure. I'm always going to be in pain. And I know it's a broken record, but I'm going to say it again. We have to change that mindset. Just because endo has no cure does not mean, I say it the third time a little louder in the back, does not mean you have to be in pain 24/7, but you have to be an active participant in your health. You have to advocate for yourself. You have to open up that toolbox and put the tools in the same way that you can put in all that negativity. Something as simple as this, right? I'm not going to say if you do what Dr. Helen said, it's going to turn all your endo pain off. But like I said, or like she said, it sure would be nice to damper it down. I mean, who wouldn't want to go from a 10 to a 7? When I was at a 10, honey, I would have did a 9.8. Anything would have been better than a 10, right? Like I just needed some relief. And so many times I just don't feel like we're equipped with the tools, or we tried a couple things, 5-10 years ago, it didn't work. And now we're just like, oh, nothing works. But that's where you come to, right? I said, booking those calls, right? Booking those appointments to where you have a team. It takes a multidisciplinary team. You're not just going to have one nutritionist or one, ND or just, one pelvic release exercise that's going to change everything. It's a full holistic approach. And so I love that because pain is huge. I have to be honest. I didn't know that I had the endometriosis issue until the pain kicked in, right? Now, some have silent endo, zero pain whatsoever. But for most of us, there was some type of pain, the murder scene period, the passing out during bowel movement. Something wasn't right where we're like, I think we got a problem. And so the pain is the biggest one. I get most of the messages I get are all about nutrition, right? Tell me the one food to turn off the pain. Tell me the one thing to decrease the this, that, and the other, the nutrition. And then it's it's like, what supplements can I take? And some of you, I love my nutraceuticals. I love my supplements, but some of you are just looking for a supplement to put a Band-Aid on everything. And maybe you're taking an anti-inflammatory, maybe you're doing all the things and nothing against that, but maybe you can bring in another tool. Dr. Helen, I'm going to pass it to you because I feel like you've got something to add to that when it comes to really adding to that toolbox.
Yes, 100%. And I think that this is difficult. It's not the same as I tore my rotator cuff, right? Mm-hmm. There's a specific muscle. The doctor is going to sew and attach that muscle, and it is very isolated, and that is healed. And then, of course, yes, we do the rehab and that sort of thing. So because it's not like that, there is no one magic fix. And when we are in pain, when we are suffering, we are looking for something to fix it. And I know that this can be triggering as we've experienced, but there is no one fix. There is a way to get out of pain, and it is a lot of work. It takes a team, right? We talked about how it could be just physiological muscle imbalances, an inflamed nervous system. It could be about the fact that we have a relationship that isn't good that flared this nervous system up. And let's go back. The brain and the nervous system's job is to keep us safe. And so how you decide to be effective with reducing that kind of high alert state just depends on who you are, what you're going through, and what your state is. And it could be changing, right? So it can be changing all the time. I truly think that the way to get out of pain is to gain a deeper understanding of our bodies, what we're going through, and really start to understand the nervous system. And I know that this nervous system could sound like a very weird, abstract thing. It's just a bunch of spaghetti, okay? It's just a bunch of the spaghetti that can get turned on and off, that knows our postures, knows our movement patterns, knows our protective patterns, and we need to tap into it because anybody that has been in pain, whether it's their pinky toe or their pelvic floor, has a nervous system that has learned that it is on high alert, and you need to tap in on how to decrease inflammation, decrease that fight or flight, and kind of tamper it down to just know what your baseline is. That doesn't mean that you're not going to have ups and downs. It just means that you know that you have a baseline to return to, and that eliminates the suffering. Even if you continue to have painful periods in your life, suffering is eliminated by understanding our body. Right. The suffering comes when we don't know what to do. Mm-hmm. And so the more that we can kind of take control, take shift of that, the more the ball's in our court.
That's huge. And some of y'all spaghetti is on fire. Mine used to be on fire, yes. Right? It's on fire.
Don't be scared. It's just spaghetti that has a lot of feelings.
Yes. So we've all got some spaghetti, but we want to damper down, right? We love those analogies over here. We want to damper down the fire and the spaghetti. Thank you so much for taking time out, because I know that the pain is something that I'd say 98% of endometriosis warriors, maybe you're dealing with PCOS, wound wellness issues, can relate to. The pain is like that throat punch Thursday that's like, hey, but this is what I want to tell you. Your pain is coming, right? Body is telling you something, but we need to find a way to channel that pain. We need to find a way to channel that energy rather than letting that pain knock us off the couch or knock us onto mattress island where we're stuck there, in debilitating pain. And like you said, suffering, like I was always hiding in plain sight. I knew the pain was there and I'd manage it and I'd do this, that, and the other, but inside I was suffering. And I love what you said. I'd love for you to say that again is, the pain and the suffering is when you don't have the information, right? And that is why I created this podcast. That is why nothing is TMI with me when it comes to my endo journey, because there was not only physical pain, but there was the mental pain, the financial pain and strain, the relationships, the lack thereof, all of these things. But now that I've been empowered and I know exactly what's going on, then maybe it's not suffering now. It's just a journey. It's part of my healing journey. And so I really want to transition you guys. I love that. We may have to do a reel about that. I love this. The pain. Say it for us one more time, Dr. Helen. We will close with that because I think that's a very powerful concept.
The pain can come in cycles. It can go up and down, but the suffering ends when you know what to do with your pain and when you have tools in your toolbox. And can I also add that the suffering ends for our loved ones, right? Yes. I feel like that's just a whole other podcast on itself. That's what it ends up doing to the relationships around you, because people have the best of intentions, but it can be a lot sometimes. So you kind of having a little bit more control over over it. You can still be in pain, but you can be like, no, I've got stuff. Thank you. And maybe I will take that advice, but I have some tools to work with now. So yes, I love the work that you're doing. I love that you are reaching so many people, and I hope that people don't give up. Our bodies are incredible and have the ability to adapt and change, and the pain will not be there forever. I promise.
All right. I'm a mic drop right there. Dr. Helen, put it down. And I think we're going to have to bring you back. There's a couple things you said, something about toxic relationships. I'm like, there's another podcast we need to do. And then also, once the suffering ends, really knowing what's going on with your body, how it affects your family, it affects your relationships. I know, and I'm guilty. We usually talk about the physical pain, this, that, and the other, but there is so much more than that. That physical pain translates into mental stress, the anxiety, the depression, the oppression, the PTSD, all the gaslighting, like it's all real. So I want to thank you once again, Dr. Helen. I may have to drag you on for a couple more episodes. We may have to go, I call it the woo-woo. What did you call it again?
My hippy dippy.
Yes, we're going to have to go hippy dippy, woo woo, whatever you want to call it. Make sure you guys tap in. So if you learned something on this episode, like I always said, go into the review, give your girl a 5-star review. Tell me what you learned. If you have questions, if you want Dr. Helen to come back on and talk about other stuff. I know that we put some tools in your toolbox. I know some of you guys are like, LJ, this toolbox is going to be 500 pounds. Baby, that's okay. Push, pull, or drag it, because every tool in the toolbox will make a huge difference.